When I first found out about the COVID-19 crisis in India, I was devastated. I was sitting in my room thinking, wow, Americans had it so bad, but compared to India, we had clinics and hospitals and resources readily available, whereas in India, these things have already been pretty hard to come by, whether they were in a global pandemic or not. India is already struggling in so many aspects, such as economically and politically, not to mention the cultural divisions and unrest implemented by the days of British imperialism. I made a decision to look into the situation at hand, not only to educate myself, but also hoping to share what I had learned with others. I guess you could say this was the product of that decision. The second wave of COVID-19 in India only just started in April. However, cases and deaths have been rising rapidly. According to Google News, there have been a total of 20,665,148 cases and 226,188 deaths. In the past 2 weeks, there have been 5,049,018 cases and 43,635 deaths. The total population of India is 3.66 billion, making it the second most populated country in the world after China, which also makes this country susceptible to transmitting the disease. In addition to this, about 2/3 of the country lives in poverty, making healthcare not easily accessible for all. In comparison, about 10.5% of Americans live in poverty, and there are 328.2 million people living here. In terms of vaccinations, there have been 130 million given in India and over 100 million in the United States. The next important thing to know is how the outburst happened.
A lot of different factors came together, and India is now experiencing a second wave of COVID that is very devastating and that has been spreading rapidly, causing, hospitals to overcrowd, there not to be enough medicine, enough vaccines, enough oxygen machines. There's a lot of shortage of those things. I'd say that it happened because of a couple of factors, including that there are a lot of people in India. A good amount of those people are on the poorer side, so they have to go to work. They have to, they have to make money for their family, which is difficult enough on a, regularly. So something like this is truly difficult to navigate for anyone who's, struggling in that area. Also, the government, I think they sort of relaxed a lot of regulations that were in place and a lot of precautions. I think that had to do with the upcoming election and, wanting to get on the good side of those voters, and that, backfired horrifically.
Luckily, there are a lot of ways that the world has responded. For example, President of the United States, Joe Biden, has pledged America's full support to provide emergency assistance and resources in the fight against COVID-19. India was there for us, and we will be there for them.
They need certain materials or certain drugs. So helping to send money to specific organizations who are buying oxygen tanks, buying or oxygen machines, buying hospital beds, maybe even opening up their house or something like that so that people can be treated there, getting different drugs or different things that, people would need. Things like that. There are a couple organizations that will be linked below for, viewers to click on that and just send some money that way. People might think, oh, this is happening in India. This won't affect me. This is not my job to worry about. And while you might be right, it's really important for us to realize that even if something's happening, far away from you, it still will affect you. This might seem like a cliche, but we are all on this earth together. And we should do what we can to help out, fellow humans, fellow people on this planet who are suffering. Do your part. Yeah, spread awareness if that's all you can do. Donate if you can.
If you or anyone you have been close to has been affected by COVID-19, or more specifically the tragic happenings in India, my heart truly goes out to you, and I hope we see better days. Reporting from Scott Saturn News, I'm Chelsea Plunkett.